Look from an organization called PAD at policing alternatives and new techniques in law enforcement. Our Aisha Howard had a conversation back in August with a representative of PAD. We're going to have a live interview on the back end of this, but we're going to play you this story from Aisha now to give you a little bit of context about this conversation coming up. Here is that piece.
We try to give you what you need. We have different size clothes, hygiene kit, your socks. It's a first aid kit. Try to make sure we keep that handy.
Their uniform is empathy.
And here are just some more hygiene kits.
Their mission, meet people where they are.
And we got a call. Here we go. Y'all get to see firsthand what we get ready to do.
Meet Beck and Bam, two of the people behind the Policing Alternatives and Diversion Initiative response team.
Service like this is definitely necessary.
Offering help to people struggling with poverty, addiction, or mental health issues in Atlanta. Our 11 Alive crew rode along with the duo as they showed us service in action.
I think every issue doesn't need police response. Sometimes it needs people who are in the peer support role or people that are trained social workers, mental health, first aid technicians. Those are some of the people that we need to kind of diffuse situations and de-escalate situations.
I got called to this work because of lived experience. I tell everybody it's not about the pay or nothing like that. This is hard work, not hard work.
PAD rolled out in Atlanta in 2017 to reduce unnecessary arrests and offer care instead of criminal charges.
It's okay, we get out and talk to you for a minute.
So, instead of calling 911,
would you like a MARTA card from us?
If you see someone in need, you can dial 311 and a PAD team is dispatched within 30 minutes.
If they see someone who has needs and you're thinking to yourself,
some extra chips, okay?
Hey, I want to help this person, but I don't know how, that person can call 311.
When responders arrive, the focus is on dignity, not discipline.
That person can accept our support and we'll figure out what that person's emergent needs are.
Let's get your peanut butter and jelly crackers.
Tanisha Dorr says one of the lowest moments of her life when she was discovered sleeping on the roof of a building.
I ended up losing my car and my apartment. Sit down, sir.
Led to the turnaround she desperately needed. The building owner called police, who then called a PAD responder.
They just listened to me, talked to me for a little bit, and next thing I know, I was already set up in a hotel.
Tanisha is one of hundreds of people PAD has helped. From January through June of this year, PAD received 675 referrals through ATL 311 for quality of life concerns.
They showed up as a person, as a real person.
The city and county jointly oversee PAD's funding. At the end of last year, a contract lapse forced PAD to temporarily pause services until the Atlanta City Council approved a $5 million extension in January.
We never know whose lives we're going to take.
For participants like Tanisha, it's a lifeline.
They're going to look at you, they're going to listen to you, they're going to hug you, and they're going to help you.
In Atlanta, Aisha Howard, 11 Alive News.
And we are going to bring in right now Carrie Mackey, who is with the Carter Center. And Carrie, you are working on this project in partnership with the Policing Alternatives and Diversion Initiative. That's PAD. We just heard our Aisha Howard with some context about the work PAD does. Carrie, let's start here. Can you tell me and tell our audience a little bit more about the research that you're undertaking and what it is revealing?
Yes, absolutely. Thanks for having me. So the Carter Center really wanted to gauge awareness, understanding, and support among the public for alternative response services in the city of Atlanta, but also Fulton County and services like PAD. And so we contracted Technometrica, which is a national polling firm, and in 2024, they conducted a survey of 1,327 people across both Atlanta and Fulton County. PAD services right now are only available in the city of Atlanta, but we wanted to understand if there was an appetite for expanding those services across Fulton County. And what we learned was that 71% of respondents really do support alternative response services like PAD instead of police for instances relating to mental health issues, substance use, homelessness concerns.
And Carrie, what kind of challenges do the providers and proponents for these sorts of law enforcement alternative techniques face in implementation and perhaps funding?
Thank you. So a key challenge is awareness. So even though there was a high percentage of respondents who support alternative response, 77% of the respondents did not even know that PAD existed. Furthermore, as already noted in this piece, there was a challenge with city funding, county funding. So, of course, we also see the challenge with sustaining and really institutionalizing alternative response, relying on city and county funds. And in our survey, we also asked respondents how they preferred such services to be funded. And we learned that 64% of respondents do prefer public funding to go towards these services.
What kind of response have these recommendations gotten from those in law enforcement?
So the other thing the Carter Center does is support the Justice Policy Board in their strategic planning, which comprises city and county officials, including APD. And so the core goal of the Justice Policy Board is to divert people away from the jail. And the APD is a part of that process. And in fact, in our own polling, we convened a multi-stakeholder group to support us in developing the tools for those surveys, and we had APD representation. So there is support. I want to make sure there's understanding, and this is another key issue when it comes to institutionalizing alternative response. We have the Center for Diversion. We also have a new co-response project that was recently launched by Fulton County. But these are not services that the community can use. And so in the piece that you just showed by PAD, really the public wants an opportunity to be able to support the individuals in their own communities that are needing services and support instead of police involvement and seeing them potentially arrested and jailed.
And when we are having this conversation about these alternative techniques and diversions, a lot of the conversation is understandably focused on folks who are struggling with issues like mental health challenges, substance use disorders, poverty, homelessness, people who are really going through it. What kind of impact does programs like PAD have on folks who get connected with PAD or a similar program as opposed to going through the traditional justice system?
Well, I'll start by answering that in saying that the Department of Justice, the Federal Department of Justice investigation into Fulton County's jail, their report in 2024 noted that on average about 62% of people in the Fulton County jail struggles with mental health issues or substance use concerns. So when we divert people away from the criminal legal system, we're really giving them an opportunity to be met with services and support and be in charge of their own recovery and their own livelihoods versus, being treated in jail, which is not a mental health institution.
And we have just one more question's worth of time left. And I want to make sure I ask you this before we let you go. To somebody who might be watching this and maybe even was a poll respondent, to somebody who is supportive, they want to see programs like PAD get more traction and more visibility and more usage, what would you want them to know? What can they do to help your work?
Well, first of all, they can call in the City of Atlanta 311 and request PAD to support people who are experiencing homelessness, poverty, mental health, and substance use challenges. But importantly, they can reach out to their city council members, they can reach out to their Fulton County commissioners and request the institutionalization of alternative response services, non-police services in our city and county.
All right, Carrie Mackey from the Carter Center, we thank you very much.